We're here today with Jim Magnuson. We're going to ask him a few questions. He's a physical therapist here in Oxnard, California. First one is, what's your job like on a typical day?
Well, no day is typical, but I'll give you a general idea. This morning I came into work at 7 o'clock, so I have patients starting at 7 in the morning. Work till about noon, and then I take a lunch break. And today I met with my partner, and we go over the finance of the business because I'm also an owner. So we have to deal with the business aspect of it. And then I went back to work and worked till 7 o'clock and met you guys. So time-wise, that's kind of how my day is built up. There are different things that go on every day.
Okay.
And we deal with athletes and with last-minute appointments trying to get in and whatnot. So you have to be flexible, but that's a typical day.
Did you always know that you would want to be a physical therapist? And how did you become this? How do you know what you wanted to be?
That's a great question. I went through my undergrad. My grandfather was a surgeon. My uncle was an OBGYN. And my cousin's a pediatrician. So I knew I wanted to do something in the medical field because my grandpa was kind of like my mentor. I didn't know what I wanted to do, so I majored in pre-med, so biology with a pre-med emphasis. Went to Cal Poly Pomona. And it wasn't until my junior year I was playing baseball semi-professionally, and I ran into a couple of physical therapists. And one of the guys asked me, hey, what are you going to do with your biology degree? I said, well, I was thinking about medicine, but I really don't want to cut into anybody. So I pursued a degree in physical therapy at Cal State Northridge. And that's kind of how I got interested.
What kind of problems do you deal with on a normal, typical day?
Okay, well, I'll put my administrative hat on. From a business owner, there are many problems to deal with, from employee relationships between employees, payroll issues. With our new Affordable Health Care Act coming out, my partner and I have to decide what we're going to do as far as offering insurance. So administratively, there's always something to do. It's like taking care of kids, so to speak, mentoring, disciplining, setting a good example, that kind of stuff from an administrative standpoint. From a physical therapy side of things, problems, gosh, I don't look at them as problems. There's always opportunities. The patient comes in and you're challenged because they have a shoulder issue and it's not getting better. What can you do to make that better? So not really a problem, more of a problem, well, I guess problem solved.
Yeah.
Those are the kind of issues that we deal with on a daily basis from patient to patient. So our philosophy is to deliver personalized care with a hands-on approach. Getting back to treating patients in an ethical and responsible manner, and actually spending time with the patient. So our therapy group is emphasis on hands-on care.
Throughout college, was it helpful in any of the classes? Like, did it prepare you for this job?
Oh, definitely. I'd say kinesiology was one of the big ones. Just anatomy and physiology was great to memorize and understand all the individual muscles and where they were, but kinesiology was more the application of what the muscle did and how it did it using levers and whatnot. So that and exercise physiology as well. Those are the two big classes I think that helped me out the most.
As a physical therapist, are there organizations that you're expected to join?
I don't know, expected is a strong word, but I would say that it would be worth your while to join the American Physical Therapy Association. It's our national organization. The organization, by joining the organization, you're held to certain ethical principles. If you don't join an organization, then you're kind of out there on your own doing your own thing. You're not beholden to any standard.
And if you could do things over again, would you choose this path?
Dude, I'd be playing with the Royals right now.
No. Right?
Are you taking any medication? No. Have you had x-rays or MRIs on it? Not at all. Okay, good. Let's take a look at you. Let's have you lie down on the table. Okay, so what happens with ultrasound is there's sound waves produced in the head of the instrument. And the sound waves go through the gel, through your skin, and down into the soft tissue. So if you think about it like a sonar in the ocean, like the sound waves going through the water, that's kind of what happens here, and it creates a micro vibration down into the tendon. Now, tendons don't typically have a great blood supply, so that's why ultrasound is pretty effective at helping them out. Okay, now I'm going to add some resistance to it. So I'm going to slide this rubber band up your thighs. And now we're going to add some resistance to it, pain-free, heels together. Okay. Rotate this top knee up toward my hand, hold it for a count of 5. 1, 2, 3, 4, 5, slowly back down. That's kind of where yours was more like the 7 out of 10.
Yeah.
Okay, so that's the area that we are focusing the treatment on.
That wraps up our interview with Jim Magnuson. Thank you very much.